Hello, hello. Good morning, people. Grab your cocktail or grab your beverage, and we're going to have a live today. For those of you newbies, I work with Whitman-Walker on a regular. Every week I go on live. We talk about a few things, so grab your stuff and let's chat. We're going to chat. Hello, hello. How are you, Brennan?
I'm doing great today, Orlando. How are you?
Doing good, doing good. So just waiting for a few people to come in. So come on in. We're talking about normalizing sex today. Yes, for those of you who don't know what that is, then stay tuned. We're going to talk about it. Just topics.
Orlando, how has your week been?
My week has been good. Super busy, busy, busy. Today I worked 8 to 5. I had a class during my lunch break. Then I had to rush over to get ready for this live. And then I have a class at 7:30. So still not over.
Man, keeping busy. That's good.
Trying to. Welcome everyone. Welcome everyone. So for those of you that don't know, I've been working with the Whitman-Walker Health Clinic for about, it'll be close to 6 to 7 months now. So we do lives every week and we talk about things, talk about COVID, we talk about sex, we talk about whatever to the topic. So make sure you tune in every week. We'll be talking about different things. Today's talk is about sex talk, normalizing sex, prevention, protection. We are open for symptomatic testing, treatment of COVID. So if you have any questions, call 202-979-4439 for same or next day appointments. For additional pharmacy resources, visit Whitman-Walker website and make sure you follow them on social media, Facebook, Twitter, and Instagram. So my name is Orlando Machuca. I'm one of your social media influencers and employed with the Whitman-Walker Health Clinic. My pronouns are he, him, his, and she, depending on who's calling me she. But yes, so it's more of a we use that term in dear, not so much because I want to be a she, but I like to be a she sometimes, if you know what I mean. All right, so during the past few months, the Whitman-Walker Health Clinic departments have expanded its outreach and efforts to social media platform. We cover various topics about HIV, STI, sexual health, access to care, social detriment of health, and general public health interventions. The next couple of series of outreach sessions will focus on the pandemic, COVID-19, ways to manage your sexual, personal, and mental health. The community health team is here to educate you and support you. So welcome, welcome, welcome. For those of you just joining in, I'm Orlando, working with the Whitman-Walker Health Clinic. And today we're talking about normalizing sex. So pretty much we're talking about sex talk and, prevention, protection, which is something we really touch bases on a lot. So let's start with, remember, we still are in a pandemic, so let's start there. Safe sex is very important. Right now, the safest sex you can have is with yourself. So you can pleasure yourself, you can watch porn, you can play with toys. Make sure you are washing your hands 20 seconds. Make sure you are washing your toys. If you're using toys or like to share toys, make sure they are clean. Make sure you wash them with the correct soap and more than 20 seconds, like your hands, to make sure you're not getting any, fluids or old stuff from any other partners you're with or been with or are sharing with. Um, Besides yourself being the safest sex partner, it's also, the next person would be someone in your quarantine circle. So that means somebody you live with, somebody you're only hanging out with that person and they are only hanging out with you. So if you're living with your partner, be mindful that if anyone leaves the house, there could be options, or there could be situations where they do contract or are exposed to COVID. So be very careful about leaving your house. If you do, stay protected. Make sure you take off clothes, you wash everything that you bring in with you, and be mindful of who you are near if you don't know if they've been exposed or not. So Also, remember, if you don't live with your partner, yes, you can go to your partner, but be very careful about going with your partner, because going from your house to their house and who you're exposed to, who they're exposed to, can create, again, more reasons or more options or more opportunities to get contacted. So, and also be very mindful that you don't want to put anyone in jeopardy. So stay home, or if you do go see your partner, stay with them. Maybe stay with them for 2 weeks and make sure you guys quarantine together. And hey, what's better than quarantining with your sex partner? All the sex you need, right? I know some of us don't have that, so it's rough. But find you a quarantine booth for our next pandemic. So today's talk is about normalizing sex. I know a lot of people are, love sex, love sex, love sex, love sex. Who doesn't love sex? I'm sure some people do. But I wanted to talk today about being okay with sex. Like, I know a lot of people are super like shaming, slut shaming, this shaming, that shaming. Oh, you're a HOE, you're a this, and you're single. As long as you're single and you're not cheating on someone, like, do you do whatever you need to do? Just remember to be safe. Take care of yourself, take care of your mind, take care of your body. Now, we do feel the need to get out. Some of us are going out. There are many restaurants open for food and for drinks. And yes, we're still being cautious in a pandemic. And maybe sex will arise, then you weren't expecting sex. So be very sure that it's okay. And we're not saying go have sex with anybody, but don't feel bad that you meet someone, you get to know them, you quarantine, have sex. We don't want people to think, and it's not just about COVID, it's in general being comfortable with liking sex. All right, as long as you're not hurting anyone or doing anything in bad intentions, do it. All right. So with that said, please make sure you're protecting yourselves and your loved ones. So here are a few tips on protection and prevention. For those of you that don't know, sexually transmitted STIs is an infection that spread during sexual contact with another person. This includes touching. Some STIs can be spread from skin to skin contacts. So in general, STIs are highly preventable. Almost 20 million new STIs are diagnosed each year in the United States, according to the Centers Disease Control and Prevention Trusted Sources, the CDC. So however, those many infections can be avoided if people made different decisions about their sexual health. So the only guaranteed method of STIs is abstain from all sexual contacts. However, most people don't find this to be a practical solution. So if engaging in any sexual activity, there are steps people can take to limit their risk for any STI and HIV. So be super careful, make sure you have these conversations. We talked about that last week, having a comfortable conversation. So make sure if you're with someone and you think on dating them, then you're having this conversation early on before you get too comfortable with them and they start, assuming it's okay with never having that conversation. Make it normal. Make it normal to have conversations with somebody you look for long term. Make it normal to have these conversations with somebody you just want to be with that night. Hey, you never know. Like, don't underestimate having a one night stand and a relationship coming out of that, or even dating. It happens a lot. So open up that mind, people. So protection before sex, even STIs, preventions begin with sexual activity occurs. Here are some of the steps you can take to reduce your risk before having sex. Limit your number of sexual partners. So if you're going to be open to sex, great, but pick and choose. Don't just sleep with strangers. Get to know them. Make sure you have a contact in case something does arise. You have a way to contact them. All right. Talk honestly with potential partners about both of your sexual histories. So you don't have to tell them how many people you slept with, but make sure you do say, hey, I am seeing people, I am talking to people, I am sleeping with people. So I want to make sure that protection is definitely on the table. Some people choose not to, and it's your choice to say yes or no. But get tested along with your partners before having sex. So if you're going to be dating them, be like, hey, let's get tested. Let's get tested together. Why not? That's super, cute little date, and it shows trust and longevity that maybe you are interested in something a little longer than a one night stand. All right. And some of you do have different partners, but again, you want to keep your circle And unless you're bringing them all at the same time, all of you need to have that talk together. That have individual talks with all your partners, right? Avoid sex while under the influence of alcohol or drugs. That's very important, guys. If you know you want to go get drunk, if you know you want to go get high, make sure you take a friend with you. Make sure you tell your friend, hey, don't let me go home with anyone. If you see me overly intoxicated, overly drunk, overly whatever you choose to do, just make sure you have somebody watching over you, or even tell the bartender. Bartenders are super great friends, to be like, hey, if you see somebody, if you see I'm too tipsy, like, make sure you just like tap me on the shoulder and say, hey, no, leave, or let them know to leave me alone. You know me, talk to people. That's why I like making friends when I go out to the bars and the clubs, because I let them know, hey, I'm not planning on doing anything with anyone. So if you see, maybe somebody's trying to roofie and you see me like dazed and I'm not drinking that much, like bring it up to my attention, bring it up to the bartender, bring it up to the security. If you see any creeps around me and I look like I'm not coherent, all right? So practicing safe sex. Having safer sex means using latex or polyurethane barrier of all forms. Sex can include using male or female condoms for intercourse, using condoms or dental dams for oral sex, using gloves or gloves for manual penetration. So rinsing off after sex can help remove any infectious material on your skin. So women in particular should urinate after sex. This can reduce the risk of any urinary tract infections, UTIs. Using condoms correctly. We use them for barriers for safer sex. So it's super important. You read the instructions on the box. Condoms, using condoms correctly makes them more effective. Follow these precautions when using them. Check the expiration dates. So important. Make sure the condom packages have air bubbles, which shows it hasn't been punctured. Put the condom on correctly. Always leave room for the tip. Just the tip. Leave room at the tip. Sorry. Oh my Lord. Unroll the condoms onto penis, not before it goes on. Use condom safe lubricant during intercourse. So do your research. Make sure you're not using terrible lube, because that can mess up the latex and it can rip the condom super easily. Hold on to the condom while withdrawing after sex so it doesn't slip off. Dispose of the condom properly. Never take a condom off and try to put it back on. Never reuse a condom. So potential risks. Condoms and other barriers are very good at preventing the exchange of infectious bodily fluids. They can also help to minimize skin-to-skin contact. This reduces transmission of disease that spreads through the touch. However, it doesn't prevent transmission entirely. STDs that spread through skin to skin, syphilis, herpes, HPV. So be super careful. Don't assume that a condom is going to protect everything. So be super, super cautious. Let's see if we have any questions real quick before we move on. We have some. Whitman-Walker is posting some stuff. So if you missed anything, read the Whitman-Walker comments and take a little Snapchat of them. And don't forget, you can always go to the Whitman-Walker page. If you have any questions, give them an email. Follow them on Instagram, Facebook, and Twitter. All right, looks like just a lot of hellos. Thank you, everyone, for all the hellos. We love it. All right, cool. Looking good. So if you're in a sexual relationship with someone who has herpes, they may want to talk to the doctor about suppressive therapy. This type of therapy helps to prevent herpes outbreaks. It also helps to prevent transmission, but it doesn't cure the infection. It's important to know that herpes can be spread even if the individual doesn't have an active outbreak. So what's today's takeaway? Have conversations with your friends. Talk about sex. Make sex okay. Again, you still want to be safe. You still want to protect yourself. So be super cautious having these conversations, whether it's long term, whether it's a one night stand. Have a conversation with your sex partners, people. All right. So though STDs are common, there are ways to reduce your risk. We talked about a couple of those. Having conversations about your sexual health with your partners is key. But not everyone with STIs know they're infected. That's why it's important to get tested before you have sex with a new partner. If you've been diagnosed, let your partners know. That way you can both make informed decisions about risk. You should also explicitly ask your partner if they have or have had. All right, whether you are shy, again, bring it up first. If you bring it up first, then you don't have to worry about it later. So wherever you guys align, we need you, we value you, we see you. Does anybody have any questions? We'll wait a little bit. Brendan, you have any questions?
Orlando, I thought that was great. Can you talk a little bit more about the male versus the female condom?
Yeah, so for those of you who don't know, condoms are not just for men. Male are obviously outside. We put them on our penises. And for women condoms, they're inside. So those are more of a, they put them in. And yes, ladies, we can wear them. And also men can wear an internal condom. So it doesn't have to be exactly for either or, but they can put them in their vaginas or in their anal. They're a little bit bigger, so that way you can leave them there. So if you know you might go have sex, you can put that in earlier. For the men, it's typical. We already know it's a regular condoms. Make sure you hold the tip before you roll those on. But yes, they are available for outside and inside condoms. So good question, Brendan. Anything else you think we should talk about?
Sounds great, man. If there are any other questions in the chat, we'd love to hear. But if not, up to you.
All right, we'll wait like a minute. But we still have, don't forget to follow us on Instagram, Facebook, Twitter, Whitman-Walker. And check out the website at www.whitmanwalker.org for up-to-date information on our services and more on COVID-19. And don't forget also our partners at Real Talk DC _, at No Filter GC, and at The Corner GC, our other partners that we use for either art or just talk about other things as well. So I don't see anything new. So I think that's it. Thank you guys. Orlando, your Whitman-Walker social influencer. Don't forget, we'll be doing a lot more chats with David, with Soul. So at least be looking for at least 3-4 times a week that we're going to be doing live. So follow Whitman-Walker. That way, if it's not me, you'll see someone else coming up. And thank you, Brendan, so much for joining us.
Thank you, Orlando. Sounds great.
We'll see you guys soon. And I'll see you guys next week on Thursday, if not sooner. Peace out. Have a great evening.